Nursing Diagnosis Part 2. Disease conditions including in this video are burn injury, breast cancer, cancer of cervix, colorectal cancer, CA larynx and CA prostrate. First one is burn injury. Nursing diagnoses are activity intolerance related to pain on exercise, limited joint mobility, muscle wasting and limited endurance. Disturbed body image related to altered appearance and self-concept. Deficient knowledge related to post-discharge home care and recovery needs. Second disease condition, breast cancer. Preoperative nursing diagnosis, deficient knowledge related to planned surgical treatment, anxiety related to cancer diagnosis, fear related to specific treatments and body image changes, risk for ineffective coping related to the diagnosis of breast cancer and treatment options, decisional conflict related to treatment options. Postoperative nursing diagnosis, pain and discomfort related to surgical procedure, disturbed sensory perception related to nerve irritation in affected arm, breast or chest wall, disturbed body image related to loss or alteration of the breast, risk for impaired adjustment related to the diagnosis of cancer and surgical treatment, self-care deficit related to partial immobility of upper extremity on operative side, risk for sexual dysfunction related to loss of body part, change in self-image and fear of partner's response, deficient knowledge related to drain management after breast surgery. Deficient knowledge related to arm exercise to regain mobility of affected extremity. Deficient knowledge related to hand and arm care after an ALND. Third disease condition, CA cervix. Anxiety related to the diagnosis of cancer, fear of pain, perceived loss of femininity or childbearing potential, disturbed body image related to altered fertility, fears about sexuality and relationship with partner and family, pain related to surgery and other adjuvant therapy, deficient knowledge related to perioperative aspects of hysterectomy and self-care. Fourth disease condition is colorectal cancer. Imbalanced nutrition, less than body requirement related to nausea and anorexia, risk for deficient fluid volume related to vomiting and dehydration, anxiety related to impending surgery and diagnosis of cancer, risk for ineffective therapeutic regimen management related to deficient knowledge concerning the diagnosis, surgical procedure and self-care after discharge, impaired skin integrity related to surgical incision, stoma and fecal contamination of periosteal skin, disturbed body image related to colostomy, ineffective sexuality pattern related to ostomy and self-concept. Fifth disease condition is CA larynx. Deficient knowledge about the surgical procedure and postoperative course, anxiety and depression related to the diagnosis of cancer and impending surgery, ineffective airway clearance related to excess mucus production secondary to surgical alteration in the airway, impaired verbal communication related to anatomic deficit secondary to removal of the larynx and edema, imbalanced nutrition less than body requirement related to inability to ingest food secondary to swallowing difficulties, disturbed body image and low self-esteem secondary to major neck surgery, change in appearance and altered structure and function, self-care deficit related to pain, weakness and fatigue, musculoskeletal impairment related to surgical procedure and postoperative course. Sixth disease condition, CA prostrate. Preoperative nursing diagnoses are anxiety related to inability to void, acute pain related to bladder distension, knowledge deficit related to treatment protocol. Postoperative nursing diagnosis, acute pain related to surgical incision, catheter placement and bladder spasm, deficient knowledge about postoperative care. Thank you for watching.